Hi friends, this is Dr. Michelle from Strength Within Physical Therapy and Wellness. Let's talk about how I got into the field of eating disorders and a bit about my own story. So I started working at Denver Health after I graduated from physical therapy school. So that was in 2008. And from physical therapy school, we really come out as generalist practitioners, and being in a hospital was super homey to me, which I know sounds maybe really silly. A little bit of background with that. So my mother is a retired ICU nurse. And so when I was in middle school, into high school, into college, I would go visit her in the intensive care units at Riley Children's Hospital. This is back in Indianapolis, Indiana. So I would see a lot of pretty crazy things in the ICUs there with my mom. I would go visit the kids and that. And so I guess I got used to hearing the alarms and things like that. But being in a hospital is kind of like a second home to me. So that was really where I chose to start my career as a physical therapist. And Denver Health was really a great starting point for me in terms of the variety that I knew I would be able to see in a level 1 trauma center and a safety net hospital as well. So really aligned with a lot of my own values. So I started working at Denver Health, and I had the opportunity to be on so many of the different units at Denver Health. So I was on the orthopedic unit where I would see patients after total knees, total hips, back surgeries, a lot of trauma. So I would see people after surgeries based on like a car accident or something like that. Spent a little bit of time here and there down in the emergency department. So we didn't get a whole lot of consults down in the emergency department, but I would spend some time down there at, various amounts of time. Some in the ICUs. There was not an area that I was super comfortable in. A lot of time on the medical surgical floors, and the majority of my time, I guess I would say, on the acute rehabilitation unit. So that's where we would do 3 hours of therapy with patient per day. It was typically 5 days a week, which I love that because I really love that ability to spend that time with my patient and really get to know them and be a part of their story. From there, we started getting consults. Let me clarify, the rehabilitation unit started getting consults for the acute center for eating disorders. And there was a colleague that was kind of fielding these consults before me. And this was the unit where it was essentially kind of like an ICU unit for eating disorder patients. And this was something that I really hadn't learned when I was in physical therapy school. And I felt really unsure of being able to have the skills that were appropriate to serve this population. Fast forward, and I began working on the acute unit and worked there for several years, which was wonderful in terms of being able to create a mobility protocol for those patients. And again, it was kind of that nice combo in terms of I really got to know my patients because I was able to spend time with them. They would typically be on the unit for anywhere from 2 weeks to 4 weeks, really depending on what their goals of care were. And so I really loved that in terms of being able to create that connection. Again, like I said before, being able to be a part of their story or a part of their journey toward recovery. So that was really great for me. One of the things that I've been asked before is if I have an eating disorder or if I have a history of an eating disorder, and kind of what my personal experience has been within, I guess, the eating disorder world is maybe how I would say that. And I'm very forthright about my own story. And what I would tell you is that I do not have a diagnosis of an eating disorder. I've never had an eating disorder. What I can say is that definitely there has been a period of time where I have personally engaged in what I would call disordered eating now, have done the diets in terms of the Weight Watchers, eating paleo, eating clean, counting macros, kind of all of those things. I have done those. So I live in this same world where we see all of these things on social media, the magazines, our friends talk about it. Maybe we hear that language in a gym community. So I'm not immune to it, I guess I would say. I've done a lot of my own work though regarding what works for me in terms of, diet, exercise, that sort of thing. Diet is not the word I want to use. Nutrition is the word I want to use, because I really don't align with the word diet so much. In terms of the movement piece, I guess that is the piece that can be a little bit more challenging for me in terms of, number one, I love to move my body, and that has really kind of always been something for me since I moved to Colorado. So I didn't really do sports in high school or into college. I did marching band when I was in high school, and I was a dancer, and I loved that. I did choir in high school as well, and I loved doing the school musical. And so that was just like, singing, dancing was kind of my thing. I was much better at the dancing part than the singing part. So I typically didn't, have like a lead role or anything like that, which was fine, because I just really wanted to like be in the background and sing and dance, which was awesome. But marching band, I loved marching band and being a part of that community. When I moved to Colorado, I think there was kind of this, actually it was probably more in college. Yeah, it was more in college, where there was really this like more of the messaging that I was getting in terms of needing to change my body and needing to look a certain way. Honestly, this was probably from high school into college, if I can think correctly. I do remember one class that I took in high school, and sorry, this is really random because some of the thoughts are coming up that I didn't actually like have in my mind, but I do want to share them with you. But when I was in high school, I was in a drafting class, an architectural drafting class. And at that time, there were more males in the class than there were females. So I felt really kind of outnumbered. And I remember we would sit on these kind of that traditional like drafting desk with the stool and that's what we would sit on. And I remember there were some boys in my class. They were cordial in class, but they would always kind of snicker and laugh. And I was like, I don't really understand what's going on here. And, I kind of felt I was the only girl in that class, so that made me feel like an outsider, I guess. And at one point in time, they shared with me that they had a nickname for me, and the nickname was Expando Butt. And that is actually how they signed my yearbook. And it's really funny because I guess it's not funny necessarily, but that's really stuck with me in terms of like, wow, like these guys are laughing because apparently when I sit on this stool, my butt looks a certain way, right? So, started to get that message that that's not right because they're making fun of me. And so I started doing like, different videotapes of like different aerobics and things like that. And I really enjoyed it. It wasn't really that I was like changing my body at that point in time. I really did love the movement, but the changing my body, the dieting piece of things really kind of came in after I had my first child. So that's what I think is so interesting, that connection in the postpartum phase of life with how the postpartum body is a little bit different. And then the messages that we have in society and in our culture in terms of like bouncing back, get your body back, all of the blah, 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 all of these things, right? And so there was really this, internal push as well in terms of wanting to feel a little bit stronger in my body because I didn't feel strong in my body. Things had changed. And it's interesting, again, this is pretty random. There's a lot of different thoughts coming into this. I remember at a time, I think it was actually after I had my second child, I felt very disconnected. Like I felt like I had an upper half and then I had legs. And so I felt very disconnected with my midsection. And so it's really interesting because when I reflect back on that, I was really kind of asking my healthcare provider for pelvic health therapy, I guess, at the time, but I didn't have those words to use. And so I felt a little bit lost. So again, I know I'm kind of jumping around different time frames, but it all kind of connects together, right? So it was really after the birth of my first child where I was hitting the gym pretty hard. So I was getting up early to go to the gym. I would start my day, I would go to classes like 5:30 in the morning, start my day. And honestly, I really loved it. I loved moving. I felt really good. I was starting to do more of the diets at that point in time, so more of the Weight Watchers. And so I was noticing my body change. And I was getting a lot of compliments on that in terms of, oh, you look great, so that really kind of fuels the fire in terms of, okay, let's continue with that, right? Because people are complimenting me. They're not calling me Expando, but they're complimenting me, right? And so that really kind of, propelled that. And then I got pregnant with my second kiddo. And that was when I shared my experience in terms of like, I felt like, an upper half and legs and no middle half. And so started to get back into movement, and I had been running before my son was born, my second pregnancy, and I wanted to get back into running, and it was really pretty interesting. I think I went for a run a week after I had my son, and that was a really bad idea because my body just wasn't ready for it. I know a lot more now than I did at that time. And my body just wasn't ready for it. So I kind of gave myself some time to heal. Never saw a pelvic health therapist, really kind of wish that I had at that point in time. And I was kind of, trying to kind of do my own things. And eventually started to kind of get back into going to the gym and things like that. And I started to get back into my early morning routine, going to 5 a.m. classes. And I started into the CrossFit world. What I would say is that this is nothing negative against the CrossFit community that I was a part of, CrossFit in general, nothing negative against that, just to clarify. For me, it became really kind of excessive. I had to go to my 5 a.m. class 5 days a week, and I had to go to the 8 a.m. class on Saturday. Like, I couldn't miss it. I absolutely couldn't miss it. I reached a threshold where I definitely was stronger. I looked stronger, and I guess I would say I was thin. And I started to reach a point where things were really, really hard. I was doing a little bit more of the counting my macros and things like that, and I couldn't lift as heavy as I wanted to. I couldn't achieve some of the goals in the gym that I wanted to, and I was having injuries. I have like a back injury that kind of comes and goes, and so I was experiencing that a lot more, and I was really angry a lot of the times. I was really frustrated because I felt very, very limited in terms of what I felt I could eat, and I felt really restricted, and I felt suffocated in a way. Like I couldn't miss a gym class, and I had to eat a certain way, and I had to keep that going. And finally, I kind of crushed and burned, honestly. And this was right before COVID. And so COVID was actually not wonderful at all, yet it kind of forced me to not go back to what I was traditionally doing, and to kind of re-look at movement, exercise, and nutrition at that point in time. So I kind of stopped doing everything. And honestly, what I can say, now granted it were like 4 years after, the start of the pandemic, and what I can tell you now is that I pretty much eat what I want to eat. I do not look the same way that I did when I was doing my CrossFit classes and doing the different restrictive dieting that I was doing. And in terms of movement, I love my Peloton. So I have my Peloton cycle, and I will do different types of movement from the Peloton. I do love to cycle, I will say that, but I love to cycle my indoor cycle, but I also love to cycle outside as well. But I'll do different types of movement from there. And the thing that I really love about that is that it's formatted in a way that I can easily tap in and do something. And it doesn't have to be a 60-minute workout. It can be so many different things, 10 minutes, 5 minutes, 20 minutes, 30 minutes. And that has been really great for me in terms of like working on that flexibility in regard to what counts as a workout. And if any of you watching this video have worked with me, know that I talk a lot about that, like what counts. And really kind of tapping into like, how does it feel after I do a 15-minute workout? Like that felt really good. Or a 10-minute workout, something like that. I don't do something every day, and I really lean into tapping into what I feel I need that day, and leaning into rest, maybe some stretching, those sorts of things. And honestly, what I can tell you is that I'm a lot happier now. In terms of being able to enjoy things with my family, whether that's like going out for ice cream or something like that, and being able to participate, not feeling guilty or shame around that, and being able to move my body, and always kind of working on the feeling stronger. Like, are we really ever gonna feel strong enough? That's a rhetorical question, because I think that that's kind of this elusive goal. Like, are we ever gonna feel strong enough? And is it ever gonna feel like enough? So anyways, that was a rambling video. Hopefully that made sense, but I just wanted to kind of share some of my background and let you know that I keep working on things that, again, I said it earlier, that I'm not immune to the things that we see on social media, you know, in magazines, on the TV, just within our society, within our culture. I am a lot better at identifying it as something that I know is not going to lead me down a really beneficial path for myself. So I can restrain from diving into some of those things that I think are not going to be really beneficial for me. So anyways, hope that's helpful to know a little bit more about me. Ask any questions, happy to chat about things. Thanks so much.